As we all get wiser, I like to say, our earlobes will lengthen a little bit and other things will sag. And also, the distance from the nose to the lip, the upper lip, will sag a little bit. So, a lot of times when we're doing surgery, we'll not only shorten the lip a little to make it look more youthful, but we'll also shorten the earlobes to make them look a little more youthful and perky. And also, if we need to, we can repair some stretched out earring holes. As long as you have your earlobe reduced by somebody that does a lot of facial plastic surgery and has a lot of experience in the anatomy and function of that area, there's really no excess risk in having your earlobe reduced, and it usually lends to a much more balanced approach and gives you your side view more facial harmony. Earlobe repair, if we do it exclusively, we can do it in the office under local, and people do very well. They can drive in, have it done, and drive themselves home. If we do it with surgery, obviously it's much easier because you have sedation with anesthesia. When you have your earlobe repaired, the way to think about it is it goes through the same wound healing properties that if you were having a blepharoplasty or your earlobe or something under your chin. And that typically is about a 2-week period. So in a week, you're about 85% healed. And then the second week, you're about 90 to 95%. So, within a week, you can do anything you want. Nobody can tell. There are several different techniques that are used to repair your earlobe. One is if we're trying to change the angle of the ear itself. The other ones are more about the earlobe, and there are external and internal type approaches. I like to do all of my surgery that I can from an inside out approach so there's no scars that are visible. For the first couple of nights after earlobe surgery, we like to have padding around the earlobe, and we like you to sleep in a recliner with an airplane type pillow around your neck so that you're not moving your head a lot. And if you do, it's more of a lean than it is actually sleeping and putting pressure on your ear itself. If you have abnormal bleeding, which is extremely rare, that's usually by people that sleep on their earlobes the first night or two. That's why we like you to be in a recliner with the airplane pillow. It's just added safety. When a person has earlobe surgery, if they're having reduction, they can certainly wear earrings. If they're having their earring hole repaired, then we like for it to heal, and then we put the earring into the hole, but we don't put it in from the start if it's being repaired. It needs to heal first. When we perform earlobe surgery, typically the access to shorten or change the contour of the earlobe is very well hidden so that there's no visible scar. Technically, when you say a scar, it means is there an incision site? And yes, there is a scarred incision site, but it's completely hidden in a natural crevice. If a person is having earlobe surgery alone, we do that as a local in the office. Most commonly, people are having that done when they're having their lower face and neck done and they're under sedation. So we go ahead and take advantage of that and do it all at the same time.